Hello again, it's Dr. Ott with the Doc and the Fam. I'm going to talk about the 2-week follow-up visit for your newborn now, and I may add some things that also apply to the 2-day follow-up as well. So we're always going to be measuring head circumference, length, and weight for all of these well-child visits, and the reason is that how a baby grows is a super big health indicator. It's important. And that's not to say that it's everything, but we do pay attention closely to that. So we're going to get stats. We're going to be looking at them on a growth chart. There are several different growth charts. They have different strengths and weaknesses. So I typically recommend the World Health Organization growth chart as our preferred choice. I recommend that over the CDC. It's more representative of different ethnic backgrounds, and it just is a small difference, but just to keep that in mind. If your baby has trisomy 21 or Down syndrome, or if your baby is premature, there are different growth charts that we track those babies on. So keep that in mind as well. So at the 2-week visit, I am expecting to see a baby back to their birth weight. If they're over it, that's fantastic. But if they're back to their birth weight or over, then everybody can breathe a big sigh of relief. We made it back. That's great. Awesome. Good news. At this time, I tell parents, especially breastfeeding parents, like, okay, we can relax a little bit. If baby goes 4 hours without a feed, that's all right. We still just want to make sure that they're getting close to 8 per day, and that way you can relax and have just a little bit longer rest in between. If you haven't started pumping yet, this is the time to start pumping. That way you can have a milk supply on hand for when you're not physically available. That is helpful. And I also want to mention vitamin D. Pretend that I said this in the 2-day follow-up also. So vitamin D is important for breastfed babies. If you are formula feeding your baby, they add vitamin D, so you can discard this information. But if you are breastfeeding, and I hope that you are, for the many benefits to both mom and baby, vitamin D is not quite adequate in breast milk. And I think that that's even truer in climates like the one where I live, where we have a lot of rain and cloud cover, and the truth is we're not outside that much as a species like we once were. So vitamin D, 400 IUs per day. Carlson's makes a good vitamin D drop where you just put one little drop on baby's tongue or on your finger and then baby's mouth or on your breast, however you want to transmit it to baby. It's meant to be 1 drop per day so that they get it every day, and I know it's hard to remember. So you will notice your pediatrician or primary care provider giving your baby a big exam. They're going to touch baby's head. They're going to look in the baby's eyes with an ophthalmoscope to look for something called the red reflex. They will probably feel baby's mouth, especially the upper palate, to make sure that all the palate is formed correctly. Maybe under the tongue to make sure we don't have tongue tie, which I talked about in one of the previous videos. They will try to look in baby's little ear canals, although these ear canals are very small right now, and it's pretty hard to see the tympanic membrane or the eardrum. That's the word. They will listen to baby's heart, make sure that we don't have any concerning extra sounds like murmurs. They will watch baby breathe, make sure that they're breathing at a healthy rate of speed and they're not working really hard. So a sign that baby's working really hard to breathe at this age is a couple of things. You will see a baby doing some flaring with their nose. So let's see if I can flare. I'm not good at that. Or they'll be retracting, which means they're sucking their ribs in a lot when they breathe. You can see that it's a lot more motion than when they're relaxed and breathing comfortably. Your doctor will feel belly and make sure that there's not a sign that baby's liver is really large. They will listen to belly. They will look at genitals, make sure that everything looks good. If it's a boy part, make sure that everything is fine with the testicles coming down, etc. They will do a little hip test. This is to make sure we don't have clicks and clunks and a sign that hips might not be well formed in there. They're also looking at baby's irritability, baby's consolability, baby's tone. So are they kind of up like this? That's normal. Or are they like floppy like this? That's not normal for a baby at this time. They're going to be looking for capillary refill. That means when you press on baby's skin, is it stay white for a long time or paler? It's a pigmented baby. how long does it take to kind of pink back up? These sort of things. They're going to be looking at baby's eyes also for signs of jaundice and yellowness, looking at baby's skin for rashes. Oh, there's so many rashes in the newborn period. And looking for diaper rash, because that'll be a thing too that you probably learned to deal with. So those are some of the overviews. And at the 2-week visit, you'll also usually get a little heel poke. This is the genetic screening, or some people just abbreviate and call it PKU. So it's really important to do this at the time of birth or 24 hours after, and again at 2 weeks of age, because some of those genetic illnesses don't actually present until they've been consuming milk for quite some time. So this is a really important one to do, and it's important to get it done at that time. All right? So that is a pretty quick overview. I'm sure there are more things, and we'll get to them, but ask me questions, send me comments, let me know what you'd like to hear more about and if this is helpful. Okay, that's your 2-week visit, and I will make another video soon for the 2-month visit. Take care.